right, everyone. So this is part two. We've already done part one in March, just introducing everyone to IFS. I talked some about how I put it into the team structure with continuing to do testing and measurement to see how clients are doing, making sure we do a lot of empathy to make sure we connect before we dive into any tool. Sometimes I think people find IFS to be so powerful and then they feel so eager to introduce that to clients and then just throw that tool at them. And then it could feel a little bit off-putting or disconnecting. And so we just make sure we still go through the team structure with measuring symptoms and your connection with the client, making sure there's solid empathy, looking at any resistance or struggles with diving in, which IFS actually does a good job at. And then this is just another method. Out of the 50 TEAM-CBT tools, I just add this as one more. And it's a powerful method, but it's not the method for anyone, just like any method that you resonate with. And for those of you who haven't met me, my name is Tyann. I am a certified TEAM-CBT therapist and trainer out of Oklahoma. And I've also recently been trained in IFS. So now I can officially be called an IFS therapist. And I just have really loved this process, having just an additional tool to do some inner work for healing traumas or spaces where people really feel like they've been stuck in. And yeah, just really excited to share this process with you. So last time in March, we've already talked about working with protective systems, making sure we don't dive into working with vulnerable, wounded parts, diving right into the trauma before the client is really ready. And so this is really very much like TEAM-CBT, where we talk about, let's work with resistance first, work with hesitation to change first before we dive into any of the healing work or the vulnerable work. So now, assuming that we've worked with the protective system, all parts of their system are willing and ready to move forward with the healing work, then we're diving into working with the exiles. And exiles are just wounded parts in our system that feels like they're still stuck or locked in a moment in time in the past. And we go through these 7 healing steps with them. I'll also bring a couple of client cases to help bring it to life and also share a bit of my healing work with you all as well. So these are the 7 healing steps, and I'm going to break down each of them more specifically for you. All right. So first, it's all about establishing a relationship. I just realized I forgot to do animation, so hopefully it's okay. You're seeing all of the bullet points at once. It's not too overwhelming. But this is now, we're assuming that the client is ready to do the healing work with a wounded part that feels stuck in the past. And so it could be a moment when they were traumatized, when they were 5 or 8 or 10. An exile is a wounded part that's younger, but it doesn't have to be a child. It could also be a teenager, and it could be a younger adult, or even last week. Like when you're really wounded, something happened a week ago. That can still be an exile that's then just really lost or stuck in that moment in time. And when we dive into this work, we start to just build a relationship, and the relationship is not necessarily from you to the client. Of course, we want that. We want a solid therapeutic connection. But the relationship that we really want, that we know is the healing agent in IFS, is the client's core self, their core adult self now, coming back to connecting with that wounded part of them. And so this is very much a visual process for them to connect with and see and actually be in relationship with that younger wounded part. And while that may feel a little bit different with this inner child work, or it could be a teenager or younger adult, it really creates a corrective experience, because these younger parts of us have needed something that wasn't met. And so a lot of complex trauma, they also label as attachment trauma, because there was something that had happened in an attachment that was quite wounding. And when they now connect with their core adult self, it really creates a healing process for that attachment. And the brain doesn't actually know right? This isn't an actual person they're connecting with, when their core adult self can just create this healing experience with their younger part. So I'll also show you that video to really help bring it to life as well. And some of the questions that we ask to make sure there's a relationship between core self and that younger part is first, now as your system's allowing you to approach this wounded part, can you see that client? I'm sorry, can you see that younger part? Can they see the part that started to carry that core wound that they've been having, that maybe continues to trigger them from time to time? And usually, core wounds carry a lot of messaging about I'm not lovable, I'm not good enough, really feeling inferior. And those are really the younger parts that get locked away. Right. And so first we're just seeing, can you see that part? How far are you away from that part of you? And are you able to get closer? We're also asking, how is that younger part of you responding as you're getting closer? Because the relationship is a two-way street. And initially, sometimes those younger parts of us are feeling really hesitant or scared to connect. That just shows that attachment wounding or attachment trauma. And so we're just really slowing down, giving that younger part of us space to build connection, to feel safer to this core adult self that's coming back to connect with them. Okay. And establishing a relationship is not just at the beginning. It's like any relationship, we need to continue to establish it throughout, making sure the connection is still strong. Just like with us and our clients, we don't just do empathy or the E part to make sure we're connecting at the beginning. We assess it throughout the work together. And so in IFS, we really assess, how do you continue to feel towards this younger part of you now? How are they responding to you? And if they're feeling compassion, curiosity, they really care about that part, we're wanting to make sure that younger part can sense it. And so that's all about establishing that relationship. And then how is that part responding to your care and sensing your presence and sensing your compassion towards them? And this is also a piece where I feel like, for those of you who are familiar with TEAM-CBT, and sometimes you feel like the double standard method falls flat. That's a compassion-based technique where we have a client see themselves in a dear friend, right? So if you see a dear friend who's exactly like you in every way, and they're going through the same struggle, and they also carry, I'm not good enough or I'm not lovable. One thing we can do and ask to assess to see if this tool is going to work is, how do you feel towards this friend? So you could hear them say like, I really care about this friend. Wow, I feel so much for them, or I feel compassion for them. Or they may say like, oh, this friend is pretty pathetic, or this friend is kind of lame. Then that really tells us this is probably not the best time to move forward with that tool. And I think this is just a simple, quick question to assess, is this time for this compassion-based technique? And is it going to be effective, depending on how they respond, on how they feel towards that friend. Right? Okay, and once you start to see that they're having a relationship, the client's core adult self coming back to whatever younger age, that they are able to get a little bit closer, that younger part is able to open up more and be receptive to the presence of the adult core self. The core self is feeling some care, some desire to be with, some curiosity or compassion towards that younger part. It's then a good time to move forward with witnessing. And witnessing is when these younger parts of us just really never quite felt like they've been seen or heard. And witnessing is such a powerful process where we finally give that younger part of us a chance to be seen and to be heard. And in doing this work now for the past year, this piece is just so moving to me, that we really create a corrective experience to allow these locked away parts to finally, maybe even for the first time, feel really fully seen and heard. And in my own work on myself, like this was a quite moving part where while I've shared some pieces of my struggle when I had what I shared with you all from the first webinar around age 7-ish to 12 or so, just a lot of social shunning from peers as being a Vietnamese immigrant and really struggling with Americanized peers, feeling like I was like a source of shame, just never quite feeling like I fit in. Being able to be witnessed and to be heard and seen in that experience was just so powerful for me. It was like, wow, for the first time, this part of me is finally feeling like there's space for me and that my experience matters. And just being able to have a space to feel fully seen and heard alone was actually quite healing and powerful. And as we do this work, and that younger part is actually sharing with the core self, they don't have to share anything that they don't want to with you as the therapist, because we believe in IFS that the core adult self is the healing agent, and getting validation, care, and love from core self is actually all that inner part needs. And so if there's anything like severe sexual abuse or something that's just very challenging for a client to share openly with you as the therapist or anyone else, you can really let them know if there's anything that there's a protective part of them that's hesitant to share. They don't have to share it openly. All they need to do is just share it with you internally. And it does the same thing. When they visualize this and they let that younger part share with core adult self, um, that starts to create the healing for them. And so I think that's also really respectful too. And we have to have like our nosy therapist parts step back as well and be willing and open to not having to pry or know everything or know all of the details, which also feels really respectful to the client's system as well. And for the most part, I've seen clients do ultimately openly share with you in this process. But it just helps their system to know that they don't have to, and they don't have to share every single detail. Okay, so sometimes spontaneously, these younger parts starts to share their experiences. They may share it through starting to even be flooded with memories or images. They can share it through words. They can share it through images to their adult core self. And it's just a more efficient way of sharing their experiences too. And if they're not spontaneously sharing it, you can just invite this part to share their experiences. So if I'm working with the client, I just share this with the client and say, as you're connecting with this younger part of you, see what does she want you to feel or know or sense about what happened to her. Let her know you want to know how hard it was for her. Let her know you want to know her experience. And we're just going to really make space for that today. And then they just do a lot of this inner work as they have that younger part share. They may start to share some things with you, like, she's showing me just how hard it was and how painful it was when that friend stopped talking to her and then just started to give her the silent treatment. And she's sharing how confused she was. So that was some of my experiences as well. I've had clients who also then just said, like, wow, this younger part of me is really showing images of when my mom just chose her boyfriend over me. And I see this empty room so often. And so we may even see moments when they share that, like, wow, I think this younger part of me has been trying to have a voice because I see this empty room all the time. Sometimes I may dream about it. Sometimes I just have images of it. But I shared with you all about the client who just carried a lot of rage and it came out as road rage. But her inner wounded part, around age 8 or so, really wanted her to know how hard it was that when mom started dating, the boyfriend didn't want anything to do with her. And so for any mistakes, anytime she talked back or expressed unhappiness, they would send her to this room that had like no decorations. It was just blank walls, and it wasn't made for a child to have fun or enjoy. It was like a room for isolation. Um, and she had to be there for hours. Like it felt like to me, like almost like cruel torture of this child. And so as she was connecting with her younger wounded child, you could see then why she carried so much anger and rage, and there was no place to express it because that was her traumatic experience that she was locked away in. You're not worthwhile was burdens that she's taken on. You deserve to be casted away. Your joys don't matter. Having a source of like toys or entertainment, she wasn't worthy of that. And then she was really angry at mom for allowing and prioritizing boyfriend, allowing boyfriend to treat her in this abusive way. And so then it made so much sense why she carried all of that rage that never really quite had a space to be heard and witnessed, right? And through this sharing, we're just wanting to make sure that their adult core self is present, the adult core self that's compassionate, curious, caring, is feeling connected with this younger part, is the healing agent. And when they receive validation care from this core self, that's really all of that they need. That creates such powerful healing for them, right? This piece says some parts need compassion. Compassion is just sensing that external love and care from their core self. Some parts also need empathy. IFS says empathy is actually core self truly feeling and sensing emotionally and physically what they went through. And that often our younger parts need both. They need to sense an external love and care from their core self, and they also need core self to really get it by feeling emotionally and even physically in their body how hard it was. And this experience sometimes can be overwhelming for the client. And so you'll see in any trauma work, the window of tolerance is really important. If you're doing written exposure therapy, EMDR, um, any form of trauma work, prolonged exposure, it's really important to keep them in this window of tolerance. You want to make sure the system is not too overwhelmed because sometimes when they're witnessing these younger experiences, it is a lot. It's something they've locked away for a long time. And how IFS makes sure that they're in their window of tolerance where they're not too activated, where you may see clients say, like, I'm panicking, this is too much, this is too overwhelming, or that's hyperarousal, or being in hypoarousal where it's also too much, but their system has then shut down. They're dissociating, they're even kind of out of their body and not quite with it with you. That's showing they're outside of their window of tolerance on both ends, where it's hyperarousal or hypoarousal, and different ways their system has just tried to cope when it's been too much, right? And so IFS wants to ask, is it okay to feel this much sadness? Is it okay to receive all of these emotions and sensations at this time from your younger part? And if they say it's too much or too overwhelming, this is where we really want to listen to that. That's their system saying, like, whoa, this is too much, too fast. Then we just let them know, okay, we're going to really slow down. And if they're saying it is too much and they're hyper aroused, we can ask, can you see if that younger part of you can know that this isn't their only chance to share what happened? And we're going to make a lot of space for them so they don't have to share everything at once with you. See if they'd even be willing to dial it down 20% or even 60%, right? Like just share some of those emotions and physical sensations. And why we're asking this is we really want that younger part to know this is the way to help them feel even more understood, right? We want to be there for them better. And if they overwhelm the system, that core self can't actually really be there for them. It's too much. And so we want to know the intention is not to shut them down or to suppress them. The intention is so core self can really be present to hear them out, to help them through this process. And that usually actually has been pretty incredible from what I've seen to help decrease the overwhelm as they're working through witnessing the trauma. And then if they're hypo-aroused, and it's too much in that way, we want to do what they call bottom up processing. So if it feels like the client's really dissociated, and this could even be through written exposure therapy, I just have them then first come back into their body, and then connect with their sensations and then connect with their thoughts. And so if it feels like they're kind of blank and gone, I would say, can you see if you could move your fingers? Can you see if you can just connect with your body again? We're going to really slow it down. It seems like there was a part of you that was really overwhelmed with this process and needed you to dissociate. That's how you've been coping, isn't it? And then we can connect with that protective part, let it know we're going to really slow down, and then just see if they can come back into their body and see what the needs are. Probably really slowing down, just getting a little bit of the witnessing at a time. And then another way they may respond, is it okay to feel this much right now? They may say it's too much, or they may say like, yeah, I think I can really handle it. It's fine. It's important to make space for this. It sounds like it's been a long time that this part has been yearning to share with me about what's happened, right? Then we can have core self tell that younger part, let her know you can handle it and that you really want to know how hard it was for her. And I'm just going to interchange pronouns, but please know I respect if it's her or he, or they are preferring they, and replacing whatever pronoun that fits your client. So let them know you can handle it, and you're going to be there until they fully feel like they feel really understood by you. Right? And this is a piece that's important. You want the part to know that you want to be there until they feel fully witnessed. And so, in even working with my IFS consultant, she asked several times, what else? What else does this younger part want you to know, feel, or sense about what happened? Does she feel like you really get it? Let her know we're going to stay with her until she feels fully heard. And just imagine how nice that feels when we've been wounded and like now there truly is fully space no matter how long it takes. And when we give them that space and then we ask, I want to just make sure, do they feel like you really get it now? And until they get there, we're going to continue to witness. It may be 2 sessions, it may be multiple sessions. But once they feel like the core self of them really get it, then we can move forward to the next step. Okay, and then once the wounded part or the exile feels fully witnessed, we go into the stage of a do-over. So in TEAM-CBT, you see this as memory rescripting. Um, and this is also another piece that's a visualization that really helps additionally reinforce a corrective experience, giving them what they needed from that time that they never had before. And like we said with the brain, that part of us really doesn't know that, oh, this didn't fully happen in real life. It just creates that healing corrective experiences, changes neural networks as they're envisioning receiving what they've needed and wanted. Okay. So wounded parts are often stuck in a traumatic moment. In EMDR, they talk about it just feels like you're locked, like that part of you is just locked away in that moment. And this really helps to begin the unlocking and the healing through. So they're no longer responding as if they're that 8-year-old that feels so unlovable. They're no longer so reactive. Like me on any source of rejection from peers, I would then have a part of me that would really feel like it needs to show up in a way that showed that I didn't have as many flaws. Let's not be too vulnerable. Let's show my achievements, right? I didn't no longer feel that urge to actually show up in that way as much anymore as I started to heal. And so the do-over is you're offering a rescripting of the past. So we're still having core self as that healing agent, uh, come back with that wounded part to a space where it was stuck. So you've been going through the witnessing, that part of them feels fully heard now. And then we're just really looking at going back into that time with them, right? So I just have them now go back to that time period with him in the way that he needed and wanted someone to be there. Tell me when you're there with them and how are you being there with them? Like, really have them fully engaged in this visual, right? And so I had a man recently that I've worked with go back to a part that was 5 that was really shamed by dad and um, just really felt like from that moment on, he had to be extra moral, had to be extra vigilant on doing the right thing, or he would receive a lot of shame. And so, just going back to that time, his younger self, that little 5-year-old boy, needed him to be there in a kind way, like just had his arm around him. And he could really lean into that. And he said this was the presence that this little boy needed this whole time. Because dad was actually like this overwhelming, really large figure that was quite loud, quite shaming, a dark, looming figure that was really over him for a very long time in his life, up until the point that we worked together, actually. And then again, we're building that relationship, right? How is it for this younger part of you to have you there? Can you tell? Is that younger part welcoming that presence? Is he kind of scared? Then we want to take some time to slowly get permission from this younger part for you to get closer. Right? And then we just ask him what he wants you to do for him back there. He's feeling fully witnessed by you now. And you're going to want to take him to a good place so he's not stuck in the past anymore. But is there first something he wants you to do for him? Some person he wants you to deal with? Whatever he wants, we're going to do for him. And usually listening to the younger part's wishes really creates good outcomes. Okay. So they may want you to restrain an adult. If there was some abuse, speak up to the adult. I've had many clients just want, can you talk to that teacher for me? Can you, not me as the therapist, but the adult core self, talk to that teacher, talk to my parent. I didn't mean to do that. Let them know that I'm actually a good boy, right? I didn't mean to make them upset. Some parts just want you to hold them, just want core self to hold them and be there with them. Some parts want vengeance. I need you to kill that perpetrator that really hurt me. And in this world, once that perpetrator is no longer there, they finally feel a little bit safer. So even though it didn't happen on the outside, again, we're talking about creating corrective experiences and healing their internal world, right? And just following the exile's wishes, being there with them, creates really good outcomes. Ask what it's like for them for you to do that. And you want to just say, like, let that younger part be right there with you as you follow through with their wishes. So they're witnessing you talk to that teacher, restrain that parent, tell that parent that's not okay to treat them that way, kill that perpetrator. They're right there with you. Ask them what is it like for them to see you do that. And then you're just saying to that younger part, let them know you're going to be protecting them from now on. So doing that could be just holding them, protecting them, etc. Right? And so that's the do-over. And we've seen that in trauma work be quite effective for people. And that's why Dr. Burns has even pulled it in as memory rescripting, for people who feel stuck in a moment, if they can come back and do some memory rescripting, it can do them some good and just feeling more empowered. And what's different here with IFS is it's not just them going back, but it's actually having this attachment figure, their core self now, really being there for them, holding them, standing up for them, really meeting their needs for the first time for a lot of people. And so we've done witnessing, younger parts feeling fully heard and understood, giving them a corrective experience with the do-over. And then a retrieval can also be really helpful, right? And so for me in my own work, the retrieval just felt so relieving. And so for me, the do-over really wasn't to talk to anyone or to do anything with anyone. It was really actually just feeling heard, feeling held by my core self, and then taking me away from that. And the visual for me was just so fascinating because while I talk about I've never quite had healing like this before, it was really the how vivid the visuals were that um, felt really powerful for me. And so my wounded part was in this light blue dress that with like white flowers on it. And she had like this greasy hair. I think that represented just feeling like really gross. The hair was like over my face, and she expressed just feeling really ugly, really unwanted. And then as she was getting retrieved, like that part just started to transform. Like the hair was no longer greasy. She merged with this part of me that used humor to try to cover up pain. That part was in like an orange-ish dress with white flowers as well. And then as I was retrieved, I was in a yellow dress. And that was like weird, like just where the subconscious took me in those visuals. And I was just telling my IFS consultant, like, this feels really strange how vivid these dresses are. And she says, we don't really know until we just ask this younger part of you, is there something it's wanting you to know about these vivid dresses and these vivid visuals that it's giving you about those dresses? And then as I connected with it, it said, it showed me this memory came up of me being in Vietnam, and I had a little yellow dress, and I was so carefree, and I forgot about that for a long time. I was 5, carefree in my yellow dress, just walking to my grandparents' house. And this part of me showed me that memory, and it represented just being really joyful, being carefree, not feeling ashamed of who I am or feeling so different. And the blue dress was like a sense of deep sadness and just feeling blue, apparently, even a sense of some level of depression that I wasn't quite aware of or gave space for. And once I transformed and was retrieved, I became and got into that space of feeling more carefree again. And so in the retrieval, we're just seeing would this younger part of you like to leave that time and place to come to a safe, more comfortable place now in the present with you? And it could also be a fantasy place. And the younger part of me just wanted to go into my front porch. That's my safe space. And that's where my little garden is with some flowers, and just felt so good being there. So let her know you're going to take care of her from now on. And she never has to go back to that time ever again. And this is the next message we want to give them, that while they felt stuck in the past, in retrieval, we're letting them know, as the core self, I'm going to be taking care of you from now on. And you never, ever have to go back to that time ever again. And I remember feeling just this great sense of relief to know that, like, oh, yeah, I don't ever have to go back to being 7 to 12-ish, of just years of receiving like this social shunning in that setting, right? And I could be in settings like at school where I actually felt like I had friends who loved and cared about me. And at home, I felt that from my parents. And it was powerful to have that visual and to know that messaging and to receive a retrieval away from that really wounding space. And then we just ask, how is she responding to that? How's that younger part of you responding to knowing that? And usually it just starts to create a lot of relief for them. And that's when we get to unloading. So once they're retrieved, and just an awareness, sometimes a younger part needs to be retrieved before they can even do some witnessing with you. So while this is in a linear step, sometimes retrieval needs to happen before witnessing, where they feel just a little bit safer to share and to make sure they can feel safe before they share their wounding with you, right? Okay, and then unloading is now we've retrieved that wounded part that we call the exile. The exile's been locked away and we've retrieved it now to a safe, comfortable space in the present with you, or it could be a fantasy place. I've had such sweet fantasy places. Like these are the parts of us that just wanted to play or wanted to relax. I've had people take their younger part to an aquarium because they love sea animals or the water. They've taken their younger part to a driving in the car. It was a teenager who just loved like space. This is my comfortable, safe space. Driving, a play, a tree house, just so many like really sweet moving spaces. That's like what they've really needed, right? A Lego home was another one. I had a client retrieve their younger part to like, they just want to play with Legos because they love it so much. And this is a room that has unlimited amount of Legos that they can just play with and be free with. And so they're now in that safe space, a fantasy space or a space in the present with core self. And you're now going to ask that younger part, is there any feelings or beliefs they got back from those times that they would like to unload now? And you could really see in TEAM-CBT, the unloading part is also just challenging beliefs or negative thoughts about themselves that they've carried for a long time, right? IFS is just doing it in this different way. But I see that part of team being quite similar to unburdening. Let's find tools that helps you to really shift and lift those beliefs that you've really internalized from these hard moments in your life. So ask her, what would she like to unload? And would she like to unload feelings and beliefs she got back there from those hard times? And if she's ready, where has she carried that in or on her body? This one's interesting because people start to connect with like, wow, she's been carrying that on, her head, and I actually get migraines a lot. And so you see like some somatic healing start to take place too. Some people may carry certain things in their stomach, like it's felt like rocks in her stomach, and then once they unburden that, they start to feel some relief from some of these somatic GI symptoms. That's been really fascinating to see as well. Sometimes there's a lot of neck strain and back strain in the visual. I had one where she was like, I've been carrying rocks in my backpack and they've been really heavy and I'm ready to release them. And so they've connected with that as like, there's been a lot of strain on the back of my neck, my lower back. And it's pretty cool to connect with how it shows up somatically. And this is just part of the visual on how would this part of you now like to unload these burdens? What would they like to give it all up to? It could be to light, water, fire, wind, actually just however they want to release the burden. Okay. And if they're a little bit confused, I just give them some examples. Like some people want to release it into the light. Some people want to be in a body of water and to release it out. I've had a client who went into this river that just kept flowing, and then that washed away the burden. Some people want to put it in a fire. I had a client who just released it into the air, but it turned into butterflies. And so the wind took it away. But as it took it away, the burdens became butterflies that flew away. Into the earth could be like someone who wants to bury it and keep it in the soil until the soil then just lets it decompose, right? And it's really any way the client wants to do that. It's a very visual process that's very personal on whatever makes sense to them. Okay, troubleshooting if they're not quite ready to let go or unload those burdens is if they say, I'm not quite ready. Sometimes they may need more witnessing. Sometimes you just negotiate and give them options. like they're not quite ready to let go of some of this, then see if like, would they like to put it in a lidded box? And they can store it away just like in a corner of the home. And they have the option of coming back to it and reconnecting with it. But they don't have to completely let it go either. And sometimes they prefer that. And then when they're ready, you just have them follow through with it. Okay, now have them release that or take it all of that out of their body, release it, whatever they chose. So now let's have her release all of that into the light and let her continue to do that until it feels complete. And just keep going, keep coming back to double check. Is there anything else that she's continued to keep in her body, around her body, that she would like to release? And then they may find something else. Oh, she stored this, or she stored that, or this was another belief about lovability. This was another belief about I'm not worthy, or I don't bring you joy. I don't bring people joy. Is there anything else that she's taken on from that time? So we just continue to come back and look at what is all of that messaging that they've internalized. So then they can continue to work on being aware of this came from the trauma. This is not the truth about them. And then they can have this visual of releasing that. And continue to ask until it feels complete. Check and double check. And then check, how does it feel in your body now? How is she feeling now that that's released? And once they release burdens, then they have a way of inviting back gifts and qualities that they've wanted or needed. And sometimes it's just accessing, because a lot of times these gifts and qualities were already there, but they were locked away as well. And once we unburden, it's now more fully accessing these gifts and qualities. And so when I ask clients this, they're usually pretty clear about, I want more self-confidence. I want more spaces to feel like I can play. I want more rest. I want to feel more alive and engaged instead of anxious all the time. And we just have them then invite these qualities into their body or just activate it more fully. And then once they're ready to do that, I also add a space of visualization of how would you like these qualities to come into your system or to be activated. And so it could be through light, or it could be like I'm soaking in this water that allows me to fully embody these gifts. These gifts are now blooming in any way that they'd like. So that's how they invite the qualities into their system. And then exploring how that feels like for them now. And let us know when that feels complete, and let them really take their time with it, like no rush. This was from a demo that I watched with Derek Scott, who runs the internal family systems out of Canada. He's unfortunately passed in this past month from cancer, actually, which was really sad. But he just wants to reassure these younger parts that sometimes feel like they're unworthy of good things. He says, let this younger part know this is an unlimited resource from the universe, and she can have as much as she'd like, as much love, as much playfulness, as much vitality, whatever it is that they're asking for, courage, strength, a voice. She can have as much as she'd like. And that will reassure them that they deserve these good things too. And let her know when that feels complete. Okay, just trucking along with the last two steps now, and then I'll show you all that. Oh, I'll make some space for questions and then show you all that demo. The next piece is integration. So integration is when we also bring back those protective parts that we've worked with from the first webinar I shared with you in the first webinar. Bring those protective parts back. The part that carried rage to protect her, the parts that carried perfectionism, the parts that then was really anxious to try to protect you from all people. Have these protective parts all come back to see her now. Now that she's unburdened, now that she's invited these really important qualities back into her system or just gained more full access to them, how do these parts of her respond now as they see her in this state? And usually, like those protective parts respond as if, like, again, they're an internal family, like, wow, maybe we don't need to protect her anymore. She's in a safe space now. She has core self there to really protect her. Maybe we don't need to be as angry. Maybe we don't need to be as scared or anxious about the world. Right? And then these protective parts, we also want to let them know that they can let go of the job of protecting her in the way that they have because she's now safe with you. You as in your core self, um, the client's core self, right? Would these protective parts also like to unload anything that they're carrying? Maybe they carried that I need to be angry all the time to protect her. I need to be really prickly in social situations so she doesn't get hurt again. And so these protective parts can unload that as well in the same way. They can also put it in the fire. They can also release it and turn that into butterflies. And let them know they don't have to come up with anything right now. Sometimes they just want to rest because these protective parts have worked very hard for a very long time, trying to achieve, trying to be accepted, trying to prevent the client from getting rejected. And so they can just rest right now if they want to, but let them know they can begin to think of new roles that they'd like to take on. And I like to share the word life giving. They can take on more life giving roles because a lot of times they've been tired of working so hard. And if they could just do anything for the client's system now, what would they like to do if they didn't have to work so hard? And some of them say, I just want to rest. I just want to play, or I want to give her confidence, like be her guide or be her um, advisor now for the next steps of her life instead of being that prickly role. And post unburdening, we just want to make sure that it sticks. And these are ways that IFS just make sure that it sticks. For us, this is like relapse prevention in TEAM-CBT, where we let them know sometimes burdens do come back, but the tools that worked for you once will work for you again, right? So this is how IFS approaches it. We continue to establish that relationship that I've talked about that's so important. And so we have client's core self continue to come back to connect with this part in this retrieve state. 3 weeks to a month is what we see they need to create change, right? We've seen a lot of research about that on 21 days for change to stick. And so we're just wanting this younger part to know that core self will continue to be there, create this attachment, maintain this attachment, and show up. And checking in just means like showing up in the way that that part needs. So, how would this part like to be in connection with you? They just want you to be there to listen. They just want you to do their hair. They just want to make sure that they're in that space still with you. They just want to see you and see that you're there with them, right? So if the burdens continue to still be gone, you just come back and just make sure that's the case. And just keep checking in until the unburdening sticks and that they continue to move forward in the way that they want to. And you're just wanting to continue trust and establishing that ongoing relationship with that part of them. Okay? Before I share about my summer sale, let me pause here and make space for questions, and then I'll show you all the demo with Richard Swartz. Oh, and I forgot to share about my own healing piece where for me, it was like I wanted, while I was in that safe space in my front yard with the flowers, for me, the unloading was to the light. And so the light then just shined as I then unloaded that I'm unlovable, or any of the immigrant parts of me needed to be locked away. And then I could embrace parts of me that were considered like fob or fresh off the boat, and to really embrace that. And so I just felt that sense in my yellow dress. My hair was getting less and less greasy as the light just shined on me and released that burden. And then I also invited in the gifts from the light as well of self-love, spaces to rest, having more balance in my life instead of working so hard to achieve and really to earn my worth or earn my place or something along those lines. And yeah, it was just very moving to go through that process. And because I've seen the healing in that client that I shared with you with the rage and receiving this for myself, I just thought this is such a cool tool to add into our arsenal of really awesome tools already, but it just had a different angle of healing that I really valued. So that was the last piece of my healing work there. And then, of course, I just continued to connect with that part, checked in, and she continued to be in that space, continued to be in her yellow dress and healed. And I noticed too, moments when I do the check in, it's like connecting with that part of me allowed even my current present self to feel more lighter and feel more warmth as well. Like she became a gift for me too. So that's a cool way for me to notice, like, oh, this visualization of checking in also does a lot for me in the present. It's not just for the wounded parts of us. Okay, so let me make some space for questions, either through the chat or through opening your mic. Totally up to you. Tammy's saying, I notice when exploring protective parts, exiles spontaneously come up. Yeah, like the angry child was there. The sad child was there. Can you advise what to do when exiles show up? Oh, great question. Definitely, that will show up. In IFS, they even see like exiles are like dying to come out. And then protective parts are like trying to suppress them, like go away, stop messing with my work or my life or my relationship. I don't need to feel all of these down feelings. And so exiles will come up, and what's helpful is have the client from their core self acknowledge the exile, like let that wounded part know that you see it, and we will get to connecting with them. But right now, we just want to make sure that this work is safe. So we're not going to dive right in, and it could overwhelm the system. And so right now, we're just working with the parts that's been protecting them just so we can get permission to do this work. But we're going to get to them and we're going to hear them out and we're going to help them heal, see how they respond to that. And then usually that wounded part is then able to just feel like, okay, I've waited 40 years or so. I can wait a little bit longer. I've waited 30 years. I can wait a little bit longer. And so it's just acknowledging those wounded parts. Great point. Like I see you and I'm going to get to you. And it's very important to like track that. And so on the client's notes, I'll be like, exile 8-year-old showed up. We want to get back to that. Exile from 15 showed up when she was sexually assaulted. And when we make a commitment to them, it's just like dating or in any relationship. If you say you'll call me, I need to know that you will. If you say that you'll come back and get back with me and then you don't show up, or you as the therapist never go back to connecting with that part of them, it continues to probably show up as depression, feeling continuously abandoned, etc. So we just want to follow through with those commitments. When working with clients who say they don't have lots of visuals, what other alternatives can we offer them? Yes, this can happen, Shelley, and actually about 10 to 20% of people don't visualize. Richard Schwartz, interestingly, is one of them, the creator of internal family systems. Michelle, I see your hand up, so I will get it to you next. Just wanted you to know that. And there's lots of ways to work with that. They don't have to see the part, they can just sense it. And so for Richard Schwartz, when he connects with the part, he's like, yeah, I can sense it's showing up in my body. I don't have a visual of it, but I can sense that part's like really heavy here in my chest. And then, what would that part want you to know? For him, it doesn't show up as images or visuals, but he can get like words about this time. Or he sensed that this was from this time on, oh, it's connecting with when I was 8. I'm seeing the number 8. And this was when my dad was really harsh with me, right? And so it's just really looking at whatever ways it shows up, even if it's not visuals, whether it's through their body, it can share with you through words. And sometimes there's just an inner sense that these parts you can still really connect with even when it's not visual. Okay. Let me know if that answers that question. Lynn, I had the same challenge. You can ask them how they are experiencing parts around their body. Excellent. And if there's words that come to mind, okay, she already got it. She covered that for you, Shelley. I should have read through that already. Lou, when you have the core self kill someone for the exile, how does that work since it's so violent? I know sometimes we feel hesitant, right? Like, oh my gosh, is that okay that they want to kill this perpetrator? And this is just knowing like, this is probably the part of them that stored a lot of hurt and anger. And it's in the system, right? It's in their imagination and it's creating this corrective experience that you're worthy of protecting. This treatment was not okay. And it usually creates really good results for them in feeling like more empowered or more peace. We don't really see any of this like then they start to act out more violently because they're actually usually trying to suppress this part of them for a very long time. And so we're just honoring spaces for like, it's okay for anger to show up. It's okay that you're so pissed off you wanted to castrate that rapist, that you wanted to kill your dad who has beaten you every day really severely, right? And so they're just seeing that. And what we're trying to create is the corrective experience of feeling like you're worthy of protection. There's some empowerment in this. You can observe this. There's someone here now that you can attach to that will meet your needs.
When I've worked with folks, this was before IFS was, this is a long time ago. But anyway, I did this kind of work, not specifically IFS, where the older self would go back to be the protector for the younger self and observe the major trauma that had occurred. And I was terrified the first time there was a lot of violence. In the person's visualization of what she would do to protect that child. But every time, without exception, all I saw was a huge weight lifting off of the person and a
Oh, I
huge amount of
know.
relief.
Oh,
And
so
anger
true.
just kind of left the room once they processed that.
Yeah, it's like really needing space for protection, and then it releases something for them. I had a client who went back and like shot, she said, two in the head, one in the heart, shot the man that sexually molested her for a couple of years. And there was such like a catharsis in witnessing that. And she was like the least violent person. So of course we don't want to do this if someone you're sensing is homicidal or something. But she was like the least violent person. And then there was something about that she said, I'm finally safe. Like in her system, she's no longer like running away from the boogeyman that it just kept feeling like someone's going to be after me. Someone's going to come in when I'm trying to sleep. Right. And so that's such a good point. Debbie, thank you for sharing that. Michelle, let me answer you since your hand's been up and you've been such an awesome helper. Thank you for that.
Oh, not really, but yeah, thanks. Mine is not really a clinical question. It's more of actually a visual question about an IFF session. Everything that you're describing, is it kind of like one long mindfulness exercise,
Mhm. Yeah.
or is the patient like the eyes open facing the therapist, have a traditional session? Like,
Mhm.
what does it look like?
What does it look like when you're engaging in this with the client?
Right. And all of this work, yeah. Is it more of a long, like mindful, like where, again, it's not a clinical question really, like, is the
Mhm.
patient with their eyes closed, like talking back, answering all of this is great,
Mhm.
these great questions and prompts, and or is
Mhm.
it more of eyes open, kind of engaged in a
Mhm.
traditional therapy session? Like,
Yeah.
yeah.
It just depends. I've actually seen both. I have had clients who said, it feels like I'm on a psychedelic trip without the shrooms because it actually feels like another layer of activation, maybe even like a hypnotic state, even more of like in between conscious awareness and subconscious awareness. So for many, once we get to this, I see they go in and out. A lot of times they're closing their eyes just to visualize if they're really visual, and then they'll come back out and open their eyes to share something with you, and then they may come back in. I've had clients who close their eyes the whole time. I've had clients who left their eyes open the whole time, but they're just looking at like a spot in the room. But it definitely does feel like a different space that's more vivid than just them doing talk therapy with you with their frontal lobe only, right? And so, yeah, a really interesting question, and that's how it seems to show up for me.
And is there any on that note, what you just said, is there at the first session, do you give the patient instructions about how to like you would do for a mindfulness exercise, or do you just kind of let whatever happens happens?
Do you give them instruction or do you just let it flow with what happens?
Yeah, like maybe give them
A little bit
permission
of
to
both.
however, yeah, you can close
Mhm.
your eyes if you'd like.
Yeah.
Okay.
Yeah, a little bit of both. And the piece I haven't shared in IFS is that we want the client to be in their core self as they're doing this healing work with their younger part. But we do a lot of work as the therapist to also be in self, where if we have parts that are like judgmental or eager to get them to heal, or it's like, oh, let's get going, or it's feeling really anxious and scared, am I doing this right? We also want to do that work to have those parts of us step back so we can really just be present from a compassionate, loving space, and from that space with no agenda. Like, I'm going to let them take the work and even trust when they have their core self show up. There's a lot of times we don't need a lot of instruction. We may just give a prompting question, but they kind of go with it. And I'm sitting back in awe, like moved by what's happening in that process. So
That makes so much sense. That last part, great. Thank you.
yeah, thank you for your great questions, Michelle. Okay, let me do a chat question and then I'll do a hand raised question. And let me make sure the demo is about 30 minutes, so we'll do questions for maybe another 10 minutes. Okay, Cody, are there ever parts disguised as exiles? How do you help the client identify what is truly an exile versus a firefighter or a manager? I don't know if they're disguised as exiles, but there is a good question to help decipher, like, is this a protective part or is this a wounded part? And we just have them ask, like, we ask them, can you see if this part is actually protecting another part of you in there? Or is this actually a wounded part that's been in your system? And so you just have them ask that part. And that question has given me so much clarity. I thought I was working with an anxious part that was protecting a client. And then that part said, actually, I'm the wounded part. I've been holding fear of the world for a very long time. Right. And so I thought I was working with a protective part. I was going to do the 6 F's with it to find and focus what job is it trying to do? Does it like its job? How would it like to change that job, etc. And it was a wounded part. And so that then tells me, okay, we need to slow down because this is actually an exile that's showing up. We want to make sure, is there any parts in the system that's concerned about doing this work with this wounded part? And so really just asking their system, because I agree, it can get kind of confusing. And their system is actually quite wise if we just ask and just have them not really think about it. They get this answer that's pretty clear. Oh, this is a wounded part that's been in there for a long time. How long has it been in there? Oh, ever since I was 4. Right. And then we just want to make sure the work is safe before we get back to that wounded part or that exile. But we reassure it that we will get back to it. We see it. We just want to make sure that the work is safe and we're going to come back to help it heal. Okay. Yeah, great questions. Tammy's asking, do we integrate with bilateral stimulation with EMDR? There are people who integrate both IFS and EMDR. Richard Swartz has also noticed, he says, it's really interesting when they're doing this work and they're fully engaged in it, you see their eyes closed and it's doing some eye movements as well, because it almost seems like it's in this REM state, like it's not fully conscious, but it's not unconscious either. And Frank Anderson is actually even creating a course that integrates EMDR and IFS. Okay. Yep. I have a question if there's time. Okay, Gary. Sandra, I would think that even the protective parts can be both protective and wounded. Oh yeah, if that part feels like it's failed to protect, is this true? Oh yeah, that's what we're talking about, where protective parts also carried burdens that during integration, we also want that part to heal, right? And so in its own way, it's probably carried some heavy burdens. But it feels pretty clear for the system when we ask, is this a part that's protecting another part in there? Because exiles aren't usually protecting another part. They're just only carrying vulnerability and this wound that's been protected. So that's how we distinguish it. Okay, we have Dawn and Jennifer, and then we'll go to Gary, and then I'll show you all the demo. Hi,
So
Dawn.
I'm wondering, I'm wondering, like, I would imagine that you set this up and kind of contextualize it with a client before you start doing the work.
Uh-huh.
um, So that, because I would imagine this takes place over several sessions, right? It doesn't get all wrapped up in 1 or 2 sessions.
Right. It's not the 2-hour cure like I think David Burns does and Richard Schwartz also does. It's like, why do all the demos finish in an hour? And when
Well,
you're doing this work, it takes months.
right, and so
Right.
on that note, I would think there'd have to be some, for lack of a better word, buy-in. Like the person's like, okay, we're going to go on this journey,
Definitely.
versus each session, oh, I don't want to talk about that because I got into a fight with my boyfriend or something, like, right? You're going to have to,
Mhm.
otherwise it could really be a long time if it's, people are like, okay, I'm in, but I'm not in. And, like, so they'd have to understand this is a process. And
Mhm.
so I would imagine it involves like orienting them to the process and
Mhm.
they having some understanding that this is going to take time to unfold. So that's one thing. And then the other thing is,
Right.
based on that, if a session ends while you're in the middle of something,
Mhm.
I imagine that you have some kind of thing where you're looking at the time and going, okay, we're going to have to like bring this down. And
Mhm.
related to that, I would imagine that you're somehow you establish a safe place for them that they can tap into near the end of the session that's grounding, and then between sessions so they're not getting activated
Mhm.
from the work that you're doing. Anyway, I know there's a lot there, but I'm just kind of
Mhm.
curious about the
Yeah.
context of all of that.
I really like that IFS does make a point to give the client a heads up, like, just want to let your system know we have about 10 minutes. And so we're going to wrap up getting to know this protective part. And then we'll get back to it. But is there right now in the 10 minutes just one more thing this part of you would like for you to know about its job or what it's doing for you? So definitely like giving the system warning. We don't want to leave them hanging in the middle and be like, oh, sorry, time's up. Now you need to go after I open up all of your systems and your wounds. So a good wrap up moments are like working with a protective part, letting them share one more thing, letting them know we're about to wrap up, getting to know, like just introducing them to the wounded part, but not doing any of the healing steps yet. You want that to go all the way through or that you have enough time for it. Um, and for sure, they say don't leave it hanging right after unloading. So don't even start it if you don't feel like you have enough time to do the invitation and the integration process there. And so that's it with like the wrapping up in a safe way, letting them know we'll get back to the system. What you're talking about on like buy-in, it's like any tool. In a lot of my IFS trainings, they say they just kind of jump into it and let the client experientially understand the work. I personally like to give a little bit more information. So as you know, in TEAM-CBT, any tool we're introducing to them, we let them know this is the gist of the tool. This is what we're aiming to do with it. And how do you feel about trying it? Right. And so I would say, IFS is a tool that can help you connect with different parts of you that have been wounded and may still impact you today. But first, we'll also work with other parts of you that have tried to protect you from getting re-wounded. So what you're sharing with me is like you're having a lot of anger and also moments of just high anxiety when you're out socially with friends. And we can really do this work to understand these parts of you and ultimately help them heal. It's a little bit different, though. It's a little bit different than traditional talk therapy, where I'll have you even like connect from your core adult self to these other parts of you to understand them better and then ultimately help them heal. I've also seen it to be pretty powerful for a lot of people. It's not for everyone, but when it works, it seems really powerful. So I dangle a bit of a carrot. I let them know it's a bit different. You know, it's a bit odd for people at first sometimes doing this kind of work, but it can be quite healing. So you're dangling the carrot. It's different than talk therapy, just that's that gentle ultimatum. And would you be interested in this? And many of my clients, after hearing that, they're like, yeah, that sounds interesting. I'd be open to seeing where that goes just because they know this is another angle of helping their healing. Did that answer your questions, Don?
Thanks. And then the one thing, like between sessions, is there like an anchoring
Mhm.
thing that they maybe could do to hang on to, like a safe
Yeah.
place to go to if they're start to ruminate about what was discussed, or you know what I mean, like
Mhm.
a
Yeah.
grounding technique or something that they're given.
I don't do as much of that, but there is an IFS therapist who works with clients who dissociate, and she does do some things like that, like have this part be in a soundproof room until we reconnect next week, like if she feels like it's needed that. Um, but what I really like in between sessions is usually by the end of the session, there's two pieces. Like, is there a commitment you can make to this part right now? And just send that part a lot of appreciation. And so usually the in-between session is following through with that commitment. Like my commitment to my angry part is like, I'll make space to really listen. And so that's what they're doing in between the sessions. My commitment is that I had a client recently who had like these two polarized parts. One part wanted her to follow through with, I want to preserve her confidentiality, but some legal case. And another part's like, I'm really scared that you'll do something crazy. And so her commitment was like, I'll continue to listen to both of these parts of me. And I'm wanting that part that's feeling scared that I'll do something crazy to know that I won't do anything crazy. I just want to make space for this part that's really angry and has been suppressed for a long time. Right. So in between sessions, it's just that work. So she's like connecting with those parts through the visual of checking in. Oh, my anger's showing up. I need to listen. That was my commitment to it. What's it trying to tell me? This part of me is scared of the anger and is polarized with it. I probably need to reassure it that we just want to make space for the anger. It doesn't mean we'll go to a crazy space. Right? So it's just following through with whatever commitment. In my IFS training, we had a woman whose commitment to her younger part was like, I'll make more time to play. And so then throughout the week, she just then followed through with that commitment, more time to relax, to play, to get her hair done. And that was actually quite helpful for her system in between. So yeah, did that answer that question, Don?
Yes, thanks. That's very helpful.
Okay. Yeah, thank you. Okay, and then Jennifer's hand was up, and then time for Gary as well.
Well, I had actually lowered my hand
You
because
change your mind?
yeah, I just
Okay.
when Michelle was asking questions, well, it doesn't feel as relevant, but what was I gonna share? Oh, I was just gonna share chime in the little piece that was so beneficial with you was about not looking for the answers, like not really trying to think
Mhm.
about what the
Oh,
answers
yes.
were, but just, that
Good point.
approach in this work is really
Mm.
helpful. It makes a big difference. And in other things too, because it can be so subtle. So like
Mm.
quieting the mind, settling down
Right.
and just letting whatever come into awareness was
Mhm.
really helpful.
Yes. Yes, so Jennifer was my volunteer for the first webinar, and I felt like it was ethical with whatever we open up to actually just do a couple of sessions to close it up or to make space for it. And then in our work together after the webinar, Jennifer's just recognizing what we did is as we do this work, oftentimes a client may have like an analytical part of them or a thinking part that comes up and tries to like figure out the answer. And what I try to do is, and you'll see Richard Swartz do it as well, is like, see if you could have that analytical part of you just relax back a bit so we could just really connect with the system and see what comes up. And that it's more of this, instead of like them saying like, I think it's a protective part, or I think it's doing this, or this seems like too much, where it's analyzing and almost like overthinking the process. Once that part relaxes back, it seems like the system is allowed to like flow more and really being in this space of listening to the parts that come up without a lot of analysis or cognitive thinking. And Jennifer was saying once we had that part relaxed back, that felt really helpful for the flow and the connection, the relationships that you continue to build internally, right? Did I hear all of that right, Jennifer?
Yeah,
Thank you
that's
so
right.
much for sharing that.
Mhm.
Okay, and lastly, Gary. And you're muted.
There you go.
Okay.
Lost you there for a second. I think you kind of answered this question, and I don't think I understood it entirely. So if you say, just go back and watch the video again and I'll get it, that's fine.
Good.
Um,
Repetition's helpful when we're learning.
yeah. So I had this patient a handful of years ago, 45 years old. Stepfather tried to rape him. Mother blamed him. It was his fault because he was wearing short pants.
Oh,
And he painted the picture. It happened in the kitchen. And so I knew the picture, and then we did a memory rescripting.
mm,
And in that memory rescripting, he going, you say to him, hey, what do you wish you could have done? And he goes, there's the bat in the corner. And now he picks the bat up and literally beats the snot out of the guy. And I have him describe it. Brains are everywhere, et cetera, et cetera. And he comes back a week later and says, for the first time in my adult life, I've slept not only one night, but every night all the way through with no nightmares.
oh, that's
His
incredible.
goal was wanting to do it again, and we did. But I always felt like it was never quite, I don't think I did a good ending, a good handoff to what needs to happen next. And I'm just curious about your thoughts, because it sounds like what you're talking about would have been good to have done, I think.
Oh, what a great question, Gary, because I felt the same in just doing memory rescripting, like just from learning that through training with David Burns, that it felt like there seemed to maybe be more that we could do, right? Because
Yeah.
then they're just in that memory rescripting and they're ready to beat their stepdad again. But it doesn't seem like it gets to like completion or closure or integration with what that's like. I mean, already it sounds incredibly helpful if they're finally feeling safe and can sleep after the perpetrator is like beaten up, or they're empowered over the perpetrator in the rescripting. And I think it's still helpful to follow through with the rest of it. Like that's the do-over. But then let's retrieve them from that time so they're not stuck there wanting to beat that perpetrator over and over again, because now they can actually be in a different space, in the present or in a fantasy space where they're not feeling that need to keep beating him up because he may get better,
Yeah.
and then they need to beat him up again. And then just go all the way through with unloading things like I'm not worthy of protection from my mom, or I'm not safe, right? People can hurt me at any time. That may be burdens he continued to carry, but maybe it was unloaded if he was able to sleep. Sometimes there's a spontaneous unburdening already.
Well,
But yeah,
there was
going all the
still
way
all
through.
those abandonment issues were still there with mother,
For sure.
but
Yeah.
well, it's your fault because you were wearing shorts. I mean,
Oh,
what?
yeah. Oh, yeah.
Uh,
Probably
um,
wants to heal with her as well. Her blaming. I'm worthy of blaming if someone were to hurt me, right?
Yeah.
Probably lots of burdens from that time that could heal. One exile was from a stepdad, but it was probably equally wounding on another level with mom blaming.
Yeah. And
Yeah.
not being able to close off the first one with the stepfather, maybe that's what kept us from moving into that.
Yeah. And you'll see like none of this stuff is new. I think Richard Swartz has just been really good at pulling all of these pieces together in this order that to me makes a lot of sense on the healing and the unburdening, where it gives rescripting some closure and even creates like new actions for change if you're inviting in like qualities of confidence, of having a voice, of speaking up more or having more self-love and things like that. It just creates more closure. He's pulled things in from Jung, he's pulled things in from ego states therapy. Obviously, family systems. He has a PhD in systems work and family therapy. And so, yeah, this is just like a cool way of pulling in like rescripting with other ways of bringing in closure for the healing process.
Yeah. Okay.
Yeah.
Are you going to be doing, like a regular training? I mean, I'd pay to take more in-depth training, even if it was me and 3 other people.
Yeah. I would love to, but we actually can't until we get certified, like an actual training where I walk you through the steps. So I'm starting my certification process, and I plan on doing a training for a trauma work once I'm certified. Like I just
Yeah.
love this work.
I don't care about getting certified, FYI.
Right,
Just
right. Yeah. Uh-huh.
so,
Yeah, they just don't want us to like put on any like writing books, putting on paid training. So this is a free workshop. I just felt so passionate about it. I
well,
wanted
that's
to share it
awesome.
with you
Thank you.
all.
Yeah.
Um, but yeah, I do plan on that in the future once I'm certified. And then I'd love to put on like a small training group. My vision is actually like a personal work practice kind of group with just 4 or 5 people where they could really fully learn the process and gain some healing along the way too. Because the best thing about the training is actually really the experiential work on yourself and seeing
Oh,
how powerful it is.
yeah.
It's like talking about it versus actually
I,
experiencing it.
I would love to beat the snot out of my kindergarten teacher.
Yeah. Yeah, exactly. We all probably have someone in mind that it would feel like pretty dang satisfying, right? To uh, speak up to them, yell at them, shoot them, beat them up in some way that actually deserves space and a voice here. So yeah, let me now take you all to the video. Share sound, optimize video. Okay. And then you'll get to see all of this come to life. And I'll also, okay, let me move it real quick. I'll also type into the chat as I'm showing it to you all what's happening, because there's some parts with working with the protective system. Aubrey Marcus is the client, and he had a critical protector. And then you'll see him work with the wounded part as well. And so I'll type into the chat what's going on, what steps from the 6Fs. The 6Fs is what we use to work with the protective system. And then I'll share with you what steps on the healing steps are. And that's what we use to work with exiles when they're ready for the healing. Lynn, still trying to get into the lottery. I know it's a process for sure. Okay. So I'm just moving the video over.
That exists, period. I mean, there's a lot of complex machines, like who actually knows how, how.
I'm sorry, I forgot to move my chat box over. Give me a second. Okay, here it is.
A CD player used to work, and that's 10-year-old technology, right? Like, I don't know how that works. Most of us don't. But if we had any idea of trying to figure it out, trying to explain what it is, we have to take the thing that's whole, just like our psyche, and break it into the parts, and then start to understand the parts. And then, of course, reassemble the parts if things aren't working in the way that's most desirable. Reassemble the parts back together in a way that fits with a little bit more awareness and a little bit more understanding. And that's what IFS has done. It's allowed a map to break apart this incredibly complex thing of the human mind, the human psyche, human self, if you will, and to help us understand so that we can understand ourselves, know thyself, that classic wisdom. So why don't you go ahead and explain not only what IFS is actually doing, but the need from your perspective, and then go into the map itself.
Okay, yeah, and it's an honor to be. I'm honored by your interest, Aubrey. I'm a fan. So, yeah, I wouldn't phrase it exactly like you did, of breaking apart the psyche. To basically, I'm inviting people to go in and witness their psyche, basically, and find, and they will find, and people have been doing this now for a long time, that the psyche contains these, what I call parts. Other people call them sub-personalities or other terms. And my take on it is, and after, now 40 years of studying and basically learning from my clients, this didn't come out of my pea brain. It's something that I'm a good scientist, basically. And I empirically studied the psyches of many of my clients, and they talked about these parts and would say things like, there's this critic inside, and then that triggers this really young, vulnerable one, and then that triggers the binging part, and so on. And in getting to know them, I ultimately concluded that, like the title of this book, there are no bad ones, that actually it's the nature of the mind to have them, to be subdivided that way. They're all there to help us in our lives, and they all bring qualities that we can use and enhance our lives. But trauma and what are called attachment injuries, so bad parenting, force them out of their naturally valuable states into roles that they don't like, but they think are necessary to keep us safe a lot of the time, because their traumas freeze them in the past during the trauma. Most of them think we're still 6 years old and they have to guard us this way. And they inject into them what I'm going to call burdens, which are extreme beliefs and emotions that came into us from the trauma and attach to these parts, almost like a virus, and then drive the way they operate thereafter, like the coronavirus. And so what I found was, if it's possible for a client to get to know a part, learn about its positive intention, even if what it's doing is destructive, and learn about what it's protecting, and we can go and heal that part, get it out, the one it's protecting, get it out of where it's stuck in the past and unburden it, then the protector can relax and do something entirely different, do what it's designed to do. So in that sense, it is quite non-pathologizing. There's no bad parts, even though many, many parts have been pathologized or been demonized, both by the culture and by psychotherapy.
One thing that I've noticed, you mentioned the critic, and one thing that I've noticed with myself and a lot of the people that I coach in the Fit for Service Fellowship is that people have developed a critic that's just a little bit harsher than the harshest critic they've experienced in their life. And this has a purpose, of course, because if your internal critic, the one that punishes you internally by the withdrawal of love, is harsher than the one that you're going to face externally, well, that our psyche thinks is going to keep us in line, right? Like that's going to prevent us from being subject to the punishment on the external. And of course, for me, that was my father. For everyone else, it's somebody that, but you can really understand that your own judge that doles out the punishment and judges you is just going to be a little bit harsher than what you've experienced in your ordinary life. But that's not a state that we want to live in, because of course I'm 25 years from living in my father's house, and I'm well past that. I don't need to carry that anymore. So talk a little bit about that particular, my example here and that part, and how we start to work with it.
Yeah, that's a great example of one of the things I'm talking about, because if I were to have you focus on that critic and find it in your body, and it's likely you'd find it in your head or around your head, and ask some questions like, why do you call me names all day? And wait for the answer to come. Don't think of the answer, just wait and see what comes back to you. You would learn that it's trying to preempt the criticism of your father. And if it does it first, then it won't be so bad when it happens. Or if it does it enough, you won't do the things that bothered your father when you were a kid. And then I would say, okay, now how do you feel toward it? Because initially, most people, when I have you focus on it to begin with, I ask, how do you feel toward it? They'll say, I hate it. It drives me crazy. Mm-hmm. Or I depend on it. I need it for my super performance. But if I get those parts to step back and just have you get curious about it, you'll learn that that's its positive intention. And then you can show it appreciation rather than, fight back. And as these parts feel appreciated, they tend to soften a lot. Mm. And then we could negotiate with your critic permission to go to the parts it protects, which would be you as a boy who was suffering when your father, was so critical. And get that boy out of where he's stuck back there.
Let's just use me as a case example, because I think this is one of the great ways to learn. So if you're asking me the question, and of course I've done a bit of work around this, but let's open it up. There's always more work to do. There's always deeper levels. So you would ask me the question of where do I feel it in my body? Yeah. And actually, when you said that, I could say that it was right here. Kind of where my clavicles meet, right underneath my throat. Mm-hmm. And I think maybe one of the reasons for that is I was always getting in trouble for things that I was saying. So it was connected to my throat, right? So I feel that energy here. So let's take it from that part of that section.
So how do you feel toward that part as you notice it there?
I feel that it's created a lot of sadness, and it's created a lot of suffering. And, of course I understand what it's been doing, but it's hard. It's hard to acknowledge how much I've suffered because of it.
Okay. So I totally get that, but we are going to ask the parts that feel so upset at it for creating the suffering to give us just a little space for now to just get to know it better. And we'll check in with them later, but see if they'd be willing to go into a kind of waiting room in there or something until we're done.
Okay, yeah.
And then focus here again and tell me how you feel toward it now.
There's a neutrality to how I feel towards it. It's just now like observing. It's like observing kind of a sharp object, an object that has like a sticker burr that's there, but I don't have any judgment towards it. I just am aware that it's there, and I feel like I can look at it objectively.
Good. And do you feel open to getting to know it?
Yeah.
Okay.
Yeah.
So just ask it what it wants you to know, and don't think of the answer. Just wait and see what comes from there. And if nothing comes, that's okay. What does it want you to know about itself?
I'm trying to help you.
Okay. And ask it more about that. How's it trying to help you?
It's trying to guide me towards actions that will put me in a position where I'm loved by the Father, mostly, and it's not just my Father, but the Father.
Mm-hmm. Does that make sense to you, Aubrey?
It does, yeah.
So let it know that that makes sense.
Yep.
And how do you feel toward it now as you get that?
There's starting to be a small bud, a growing feeling of gratitude towards it.
Yeah, so if you can just give it that small bud, just let it know you get it's trying really hard to help in that way.
Mm.
And just see how it reacts to that gratitude.
I can almost visualize it flourishing with a little bit of light. Like it's instead of being hard and calcified, it's now like breathing. It has almost life force energy into it, energy that almost gives it the potential to grow, transform, alchemize it. It's alive.
That's great. So ask it if we could go to the part that it's been trying to get this love for from your father and the father,
Mm-hmm.
and we could help that one so that it didn't need that love quite as much from that place. Would it have to work so hard inside?
Yeah, it's serving a happy little boy, a boy that likes to laugh, that likes to make jokes, is inherently a bit of a rascal, but is always full of love and joy.
Yeah. So ask again, if we could go to that boy and help him so he didn't feel such need for the love, because he could get that love from you, would this part have to work so hard and be so critical?
No, that part could grow its own sprouts, and instead of becoming this sticker burr seed, it could germinate and assimilate back into my body. I could just see that, like that seed that had all the sharp little edges, it could just expand and grow and sprout leaves and become a part of me.
Great. So then ask it if it would give us permission to go to that boy and help him.
Yeah.
All right, Aubrey. So focus on that boy and find him in your body, around your body.
He's right at my solar plexus, right before it connects to my sternum.
Okay, good. And how do you feel toward him as you notice him there?
I feel like I don't know him as well as I'd like to know him.
Okay. All right, so let him know you'd like to get to know him better and just see what he wants you to know about himself.
He says, I am you.
Right. How's that feel to hear?
Feels good. I mean, a huge smile is on my face right now, to just recognize that joyous boy is still me.
Yeah. Yeah, it's great. And anything else he wants you to know about. And ask him if it's true that he craves your father or the father's, love.
Yeah, he does. He says actually more than anything. And I think there's an awareness that I've received the love that I'm looking for from the feminine, but what he's been lacking is the love from the masculine, the father.
Okay. So let him know you get that.
Mm-hmm.
Yeah. And you do see him, Aubrey, or you just sense him in there?
What would I be looking for? Would I be looking for an anthropomorphized, like a little version of me, or a shape or an image like I saw?
No, I don't want you to look. I'm just asking if you see him or just sense him.
It's a sensing more than a seeing.
Okay. And do you have a sense of how close you are to him in terms of feet away?
Yeah, about 2.5 feet away.
Okay, perfect. All right. So from that proximity, just let him know you care about him and see how he reacts.
yeah, I reach out my hands, and now he has more of a shape, still amorphous, hard to pick out details, but I know that we're holding hands, and I can see that he's starting to smile, but he doesn't fully trust yet that it's safe to come home.
That's right. And ask him more about that. Why doesn't he trust you?
He's afraid of that judge, that critic that was up in my throat. He's afraid of that part of me, and that's why he doesn't want to come home.
Okay, so does that make sense?
Yeah.
So let him know you don't expect him to come home until that part is transformed. But that's part of what we're doing with this.
Yeah, he says, I trust you.
Okay, good.
He's trusting me to invite him when it's safe.
Yeah. Okay. All right. So we've done a lot already, and you have the option to do one more step if you're up for it.
Let's go.
All right. So ask this boy where he's stuck in the past, or what he wants you to know about what happened to him. And just don't think again. Just wait and see what comes to you.
It's like says it's 6 years old, and some, one of the incidents, I'm not really clear. I have some in my mind. It might have been 6, but there was such a shock to my nervous system. It was almost, if he wants me to see, there was almost like he got struck by lightning, and that, I guess, kind of froze him and scared him.
That's right. Yeah, and you don't have to give us details if you don't want, but just tell him to really let you get how shocking that was. Just everything he wants you to see, sense, and feel about that experience. Just tell him you're ready to really get it now.
Yeah, I do. I'll tell a brief story. So this wasn't physical abuse. This was just emotional. This was, my father struggled with, different rage, and he would express it kind of verbally and emotionally. And there was one particularly gnarly experience in a hotel room in New York. And that was the one that I had to do the most work healing. And actually it was, 20 years ago, I was working with a shaman out in New Mexico, obviously very blessed to be on this path. And it was I don't know what it was. It might've been Vilca, but it was a DMT snuff. And I'd had no intention of going back anywhere. It wasn't guided in that way, but I went right back to that hotel room. But I went, and I was I was 20, 21 years old at that point. So I was big and strong. I was in college, and I went back to that point, and, but I was back there with my adult body, and I confronted my father, who was yelling at me. And at that point, I confronted him, and, but I was strong. And I said, try that now, Dad, and it was just like a reclaiming of my power. And I kind of rewrote that situation in my mind with that psychedelic experience that I had. I rewrote it to a place where it wasn't scary anymore, because I asserted my own power, like my willingness to show up. But what I haven't done until now is actually listen and hear from that little boy how intense that was, how shocking that was to my system, right? Like I kind of recoded it in my mind with this other assertion of I'm strong, and this won't happen to me again. But I didn't come with that compassionate, no, I see you and I feel you.
Yeah. So go back to him, to the boy, and ask him if now he does feel like you get it, or if there's more he wants you to see or sense or feel.
It's almost like he's been waiting to tell me for a long time how intense this was, and and he really wants to like he wants to like remind me of like it was a flush that went all the way to the top of my head. It went all the way through my organs. Like he's like no, you really got to know this was deep. This was really deep, you know. And so he's insisted on letting me know how intense the experience was, and I can.
So you're up for that?
I can feel that. Yeah.
Yeah. So tell him to really let you get it now. Just that you can handle it and that you're ready. You really want to feel it.
Yeah. It's a lot.
Yeah. It's okay. It's okay to feel all this?
Yeah.
Yeah. So tell him it's a lot and it's okay to let you finally get it.
I feel you, Aubrey. I feel you. I know. I know. I can feel myself holding him in an embrace and just letting him know, like, I know it was hard and I know it hurt. And it's okay. It's okay. Like, I got you.
Yeah, actually, Aubrey, I'd like you to go into that scene and hold him there in that way. And just tell me when you're in there with him.
Okay.
How's he reacting to you being there?
It's still hard, but he's really grateful, and he's just, you know, saying, don't leave me, you know, don't leave me alone to go through this.
What do you say to him?
I got you, and I'll never leave you.
That's right. That's perfect. And how's that for him to hear?
It changes everything, honestly. It's still really hard, but he knows that he's going to be okay. You know, he knows the part of me that's going to him there is a part that's so much more powerful than the part of my father that was expressing itself. It's like he's being held by a dragon, and there's a wolf there. It's just like he knows that he's held by something that can keep him safe.
And ask now if there's anything he wants you to do for him back there, or if he just wants to leave and come with you to a safe place.
He just wants me to be gentle, to wipe his tears, to hold his heart, to pet his head, to hold him when it's all over.
Perfect. Let's do that.
Okay.
And now see if he'd like to leave that time and place with you so you can take care of him.
Yeah, he's ready to get out of there.
That he's ready, yeah. So let's take him. He can come into the present with you, or he could go to a fantasy place. It's really up to him, wherever he'd like to be.
He wants to go play for a while.
Yeah.
He wants to go play for a while. And there's a place that my mom set up for me, partly because, you know, my mom and my dad were divorced, and she set it up as like a place for me to go in my own little fantasy world. It was up in the attic, and it was called Candyland, and it it was all carpeted, and it was all cool, and it had pictures of different types of candy, like posters of candy up there on the walls, and it's like he wants to go like play around in Candyland and just enjoy himself for a while.
That's great. So let's take him to Candyland.
All right. He's showing me all of the old He-Man figurines and My Little Ponies. Yes, it's embarrassing. I love My Little Ponies. I loved them. I still love them, actually. They don't smell the same as they used to, but I still have a great affinity for a good
That's
My Little Pony.
fantastic.
But yeah, he's showing me all of his little toys, and he's just showing me the part of him that likes to play, and it's like we're reconnected now. As you know, it's really beautiful, actually.
It is beautiful. Very moving for me as well. And so tell him he can stay there. He never has to go back to that time.
Mm.
And you are going to be taking care of him now.
Yeah. Yeah.
And given that, see if he's ready to unload all these feelings and beliefs that he got from that experience.
It's not completely. He's like he's happy and he trusts me and he wants to continue to like develop the relationship, but he's still healing in a little bit of a way. It's like there's
Yeah, that's fine. There's no pressure to do that.
mm-hmm.
Although as an alternative, he could take it out of his body and put it in a box in case he needs it. Just ask him if that would work for him.
Yeah, I saw immediately. There's it's actually a box that I have now, but it's a box it's made up of cut and pressed ayahuasca flowers, and it's formed into a box, and it has a little lid that opens. And I saw immediately that box, and he was immediately eager to put it into that box.
Okay, fantastic. So ask him how he feels without it now.
He's exuberant, and he wants to travel far beyond Candyland now. Now he wants to go all over and explore in the forests and the land, and he wants to journey with me.
Okay, so tell him that's good. And if he wants to, before you start those journeys, he can invite now into his body qualities he'd like to have, and you can just see what comes in to him now.
Courage and faith.
It's great. Okay, so again, tell him you're going to stay connected to him this way.
Mm-hmm.
And then let's go back to the original part, to the
Mm-hmm.
and bring him in to see this boy now that he doesn't need that love. So this part doesn't have to do this job anymore. And just see how it reacts to this.
It's like it cracked open entirely and exposed like a hollow interior, and it's empty now. It's like empty of the gravity and the energy and the weight, and it's like a walnut shell, and it's open.
It's great. And you can ask it what it'd like to do inside of you now instead of being so nasty.
Well, it doesn't want to dissolve permanently. It says like, I'll be there if you need me, but until then I'm off duty, basically. Like
Wants to rest, yeah.
Yeah, totally.
So let it know it can do that. It can just rest. Yeah. Okay. All right, Arby, does that feel complete for now?
It does. Thank you so much for that.
Thank you. Very, very moving for me. I have a very similar setup and have boys stuck in similar places. So it's really, you worked for me as well.
Yeah. Yeah, it was incredibly powerful, and I think illustrative of how powerful your system really is. You know, I mean, that
Okay, so that was the demo. And just a heads up, it doesn't usually finish in 30 minutes for us when we're when we're doing this work. I'm like, I've been working with a protective system for 6 months and we're still not accessing a wounded part yet. So don't feel that pressure to feel like you have to recreate that 2-hour cure or 1-hour cure. But it is just a really moving example of just that self to younger part relationship. And you could see he didn't even have to share a lot of details. Like, again, our nosy therapist part has to step back a bit and just let the client share as much as they want, and they're sharing it with their system, and it still becomes quite healing. Especially clients with trauma, there are just some things that are very challenging or painful to verbalize, and I think it's quite respectful to just allow them to go at the pace, share at the level that feels really right to them. Okay, so we have 4 minutes. Are there other thoughts or questions from watching that demo? Yeah, it's wonderful to see this masterful work with Richard Swartz. Yeah. And you could really see too when the therapist is in self, it's like, I have no agenda. I'm not pushing you one way or the other. The boy's not ready. He doesn't have to, like, no pressure. Let's really respect that. Um, okay. Yeah, people are they like that he didn't have to share everything. Um, Sometimes it's really painful to rehash, or could even get them outside of their window of tolerance if they're having to go into a lot of detail. I think this is probably why there's like a 60% dropout rate for prolonged exposure, because you're doing this verbal sharing of all of the details from beginning to end, and it probably gets them outside of their window of tolerance, and it's just a little bit too much, too overwhelming for the system. So this really allows for that balance that still gives the healing and they still feel fully witnessed. Yeah, it's beautiful to witness this work. Yes, thank you for guiding us along with the video to understand the steps. Yeah, for sure. And I've watched this before I actually received training. And now after the training, I'm like, oh, I'm understanding more. This is what he was doing with that question. And I could share that with you too. So that was cool to see. Yeah, Jennifer, it's amazing to watch. I've experienced some IFS myself as a client. That's so awesome. I can see additional steps that may be ahead. Very exciting and hopeful. Yeah, for sure. I've been working with a client for, gosh, I think at least 5 or 6 months now, and we're like almost there with the healing steps, because again, no agenda, no rush. When the system's ready, it's not been quite ready to go there. And it is very exciting as we look at the steps going forward, what's ahead, and some really powerful shifts for some people through the unburdening for sure. Yeah. Wonderful to see the process. Do we have a feedback form? Thank you, Debbie, for the reminder. I do have it up here. So it's in your PowerPoint slides. It's the very last slides with the link, but I'm also going to send it into the chat. So always appreciate your feedback. Yeah, I'm glad the play-by-play was helpful. I had always wished for that as I was watching demos. I'm like, what are they trying to do with this? Or this question feels weird or kind of odd, or if you don't know the model, it doesn't feel as logical. So I thought that could be a cool way to learn the process. Yes, continuing education for IFS, if it's not the IFS Institute, yeah, I get it. It's very expensive. Like, I definitely hesitated. I applied for multiple lotteries as well. So it's a hard process to get into and also a big financial investment. And so I have had in my step-by-step guide some resources that you could go through just for your own learning in that. I think the one that I have for Frank Anderson has already started halfway though. So I'll see if there's any other ones that I could send to you all with the recording as well. Yeah. Yeah, Robert, a lot of work to say it out loud too complicated to mix up. It's very nice that the parts get checked in with again and again, validated. Yeah, that's what we need, right? These parts of us really just represent us as human beings. What is our core needs? To be validated, to be seen, to be heard, to be understood, to receive love and care from an attachment figure that's consistent. If they make a commitment to you, they come back, right? That's all of our needs. And that's why this creates such a corrective experience, because we're just tapping into our deeper human needs for sure. Okay, so it is 12:30. I wanted to share with you all a couple of training offerings just for the summer if you're interested in learning more about TEAM-CBT. So you can go through this link that's also in your PowerPoint slides, and you can get a demo of TEAM-CBT in 8 telehealth sessions where I work with a real person working through her mood, depression, anxiety, and anger. So you'll see all of our 6 treatment models from TEAM-CBT there for treating depression and anxiety. There's a habits and addictions course. I think TEAM-CBT is actually the best approach for habits and addictions. And then I also integrate some IFS in my relationships work. And you can also purchase that course. So you just go through that link and you'll see all 3 of those courses available if you're interested in some on-demand learning for the summer. And I highly encourage getting with a therapist friend to do that together as well. Okay. So just to discuss, practice, learn the tools together. And it's good to have an accountability buddy, because I know a lot of times online courses are easier to purchase and then set aside. So if you have someone to keep you accountable, it can be really helpful. But yeah, that is it for now. Thank you so much, everyone. It is already 12:32, so I appreciate all of your time and being present.